What is schizophrenia? Does it mean by splitting of mind? Or split of personality, which some people may portray it? Scientifically, what is actually schizophrenia is all about? It is a chronic brain disorder that affects the person's personality and behavior. How do we recognize that the person has traits that associate with that disease? The symptoms of the schizophrenia can be categorized into two, which are positive and negative. Let's go to the positive symptom first. It is more related to the personality disorder, such as hallucination, delusions, confused thoughts and speech, and trouble concentration. However, for negative symptoms related to their behaviors which they struggle with their daily routine, such as not taking care of themselves and cannot mingle in the society.
If you know someone with schizophrenia, you must be curious what had caused the disease. First is the genetic factor. Think of your gene as a blueprint of your body. If there is a change to this instruction, it can sometimes increase your odds for developing this disease. Do you know that you are more likely to get schizophrenia if someone in your family has it? But some, with no family history of schizophrenia, a gene may have changed and mutated. The second causes is due to the neurotransmitter abnormality. The consumption of antipsychotic drugs such as amphetamine will eventually excite the psychotic symptoms of schizophrenia. In human brain, dopamine is an important neurotransmitter that allows signal to pass between various nerve cells. It usually collaborates with serotonin to produce happiness and become motivated. However, during the mesolimbic pathway in the brain, when too much dopamine is created, the dopamine is then released at the synaptic cleft and bind to the D2 receptor, and the signal will then create more imagination rather than the usual we normally do. This will lead to hallucination, delusion, which are characterized in positive symptoms. In contrast, in mesocortical pathway, the dopamine is released in quite small amount of numbers and will result to the negative symptoms. Other factor that influence this psychotic disorder is an anatomic abnormality. Neuroimaging studies shows differences between the brain with schizophrenia and without schizophrenia. For example, the ventricles is somewhat larger and there is decreased brain volume and there are changes seen in the hippocampus. Besides that, schizophrenia might be caused by inflammation and immune function. Those at risk of schizophrenia have higher level of immune cells activity in their brain that will cause inflammation. In response to the damage and infection in the brain, this will activate the microglial cells. In this case, microglial cells make errors in their pruning and make inappropriate connection between cells.
But every disease must have their own treatment to reduce its symptom. Same goes to schizophrenia. One of the treatment that is available is by taking medication named antipsychotic drug that can be categorized into first generation and second generation. The indication of the drug is to suppress dopamine level in the brain and prevent the relapse or recall reoccurrence of the symptoms. However, the patient that undergoes this treatment must be monitored closely since there's a number of side effects, such as muscle stiffness, weight gain, extrapolate effect that involve in movement, and etc. However, second generation is more newer and preferred by the doctors as it has lower rates of side effects. The other option that we have is non-medication treatment, which is social treatment. The first common treatment is the psychotherapy. It is performed by the psychotherapist to get update about the patient's current condition, and by having that segment, they can suggest and identify the next step for future improvement. Next is the rehabilitation. Its function to return back the normal life of the patient, such as coming back to the schools and handling normal routines that involve in a working environment. Also, community center. This is usually applied for patients that usually doesn't want any help, but they knew they needed it the most. It is where they find or search or seek people that needed to get the further treatment regarding this disease. Lastly, one of the major roles in the treatment is support groups, or we can call it as a support system. Our support system is usually involve families, friends, and sometimes psychologists. All of these treatments involve improving the quality of life for a long-term period.
We have reached at the last part of our learning. We can say that, unfortunately, this disease has no cure. This situation cannot be done alone professionally. It requires everyone to step in and get involved regarding this disease, whether by education or by creating a stress-free environment. But the most important thing that we must remember is this illness is a test from Allah. He wants to test our level of faith to Him. That's why, as a Muslim, we should seek help from Him. As stated in Al-Quran, Surah Al-Baqarah, Allah burdens not a person beyond his scope. Thus, don't be sad because Allah loves us.